Pullorum disease in poultry. The historical name for this disease is Bacillary white diarrhea. Pullorum disease is caused by Salmonella enterica pullorum and is characterized by very high mortality in young chickens and turkeys. Affected birds huddle near the heat source, are anorectic, weak, depressed, and have white fecal material pasted to the vent area. Etiology and transmission of pullorum disease in poultry. Infections with Salmonella enterica pullorum usually cause very high mortality, potentially approaching 100%, in young chickens and turkeys within the first 23 weeks of age. In adult chickens, mortality may be high, but frequently there are no clinical signs. Transmission can be vertical transovarian but also occurs via direct or indirect contact with infected birds' respiratory or fecal or contaminated feed, water, or litter. Infection transmitted via egg or hatchery contamination usually results in death during the first few days of life up to 23 weeks of age. Transmission between farms is due to poor biosecurity. Clinical findings and lesions of pullorum disease in poultry. The disease may be seen in all age groups, but birds for weeks old are most commonly affected. Birds may die in the hatcheries shortly after hatching. Affected birds huddle near a heat source, are anorectic, appear weak, have whitish fecal pasting around the vent diarrhea. Lesions in young birds usually include unabsorbed yolk sacs and classic gray nodules in the liver, spleen, lungs, heart, gizzard, and intestine. Firm, cheesy material in the cecocecal cores and raised plaques in the mucosa of the lower intestine are sometimes seen. Occasionally, synovitis is prominent. Sometimes, grayish-whitish miliary necrosis are found out in the liver. Ureters are often filled with urates. A characteristic lesion for acute fowl typhoid in adult birds is the enlarged and bronze-greenish tint of liver. In some instances, the enlarged liver is mottled with multiple miliary necrosis. The spleen is 2 to 3 times bigger, sometimes with grayish-whitish nodules promenading on the surface, representing hyperplastic follicles. Often, enteritis, especially of the anterior part of small intestine, sometimes with ulcerations, is present. The lungs acquire a characteristic brown color. Here, necrosis and, following their organization, sarcoma-like nodules. Diagnosis of pullorum disease in poultry. Serologic testing to detect potentially positive birds, but isolation, identification, and serotyping is essential to confirm infection. Treatment and control. Freedom from infection and elimination of positive birds and flocks is key to control. Treatment will not eliminate the carrier state and is never recommended. Control is based on routine serologic testing of breeding stock to assure freedom from infection. In addition, management and biosecurity measures should be taken to reduce the introduction of S. enterica pullorum from feed, water, wild birds, rodents, insects, or people.